Today, we're here to talk about rare diseases. So, rare diseases, while individually common, collectively they affect millions of families worldwide. Over 7,000 distinct conditions have been identified. For parents and caregivers, children living with these conditions, particularly those with genetic epilepsies like DEEs, an example is SEN2A, which is where I fit in. My son has SEN2A related disorder. Caregiving in this space can be incredibly isolating. The rarity of each condition often means there's limited access to shared experience and peer support that families dealing with more common diagnoses might find through established advocacy networks. And today we have Dr Eden Robertson, whom I've known for many years from when she was working on projects related to DEEs and information accessibilities. I'd like to introduce Eden to you now. Eden is an experienced psychosocial researcher with her research focus on exploring unmet psychosocial needs of families impacted by rare diseases and co-designing interventions with the community in response to these. She is an experienced postdoctoral researcher, and I'm really pleased to introduce you today when we're going to talk about caregiving and some of the impacts of caregiving. Do you want to tell us about what you're doing now and where your passion is in this area?
Sure. Thanks, Kris. Thanks for having me. I'm continuing to do research around the rare disease space. My passion is really working with the community, understanding their experiences, their needs, and developing in partnership with those consumers and the communities interventions that can address their unmet psychosocial needs. And so I'm working in the academic space in research setting, as well as working at the far end of the translational space in New South Wales Health.
I think as families, we always like to hear that there's people working on that translational piece that are really going to have a positive impact. So I've got some questions today that we're going to run through, but feel free to bring in anything while we're going through those questions. What does the research tell us about the impact of caring for a child with a rare condition?
Yeah, so I suppose how you started this interview, Kris, is really important to note that rare diseases, whilst collectively quite common, are extremely unique in how they present and ultimately how they affect caregivers and the patients. SEN2A fits under that umbrella group of conditions called Developmental and Epileptic Encephalopathies, as you know. And these conditions are quite severe and with little information available out there for families. There's few treatment or limited to no treatment options. And ultimately, these combined can have a significant impact on caregivers' lives, on their quality of life, their well-being, and that can then lead to clinical symptoms of depression, anxiety, and impacts family functioning as a whole.
It does impact the whole family, and sometimes that caregiving role is spread out, further than the parents, for example, grandparents and siblings. You talked about some of the impacts. What sort of things have you seen in your work?
I've been able to connect with a lot of families across several different conditions. One of the things I've found is that we often see high distress in the caregivers that have a child with a DEE, like SEN2A, compared to other serious conditions that are perhaps more acute in nature, that stabilize over time and the families know what to expect in the journey to come, or where there may be more information and treatment pathways available. So DEEs are really this unique group of conditions that have a high burdensome on the family, which can be really difficult. I think some of the research that I've conducted looking at the social care related quality of life of parents and caregivers who have a child with a DEE, one of the key findings that we found was that it doesn't necessarily mean that they will have a poor quality of life just because they have a child with this condition. We saw a huge range of outcomes for families. Some caregivers were doing quite well and others were doing not as well. That really highlights to us there are potential modifiable factors and interventions we could implement to support the caregivers that aren't doing as well to get them onto the same level that the caregivers who are doing well.
We worked on a project together. It was a pilot project for caregivers. We found through that project that finding someone who just understood what you were going through sort of provided some sense of belonging, which, is not easy to find in the rare disease space. So why is it important for us to measure and understand the caregiver quality of lives?
I think understanding caregivers' quality of life is just so important. I think it allows us to identify caregivers who are at particularly increased risk for poorer psychosocial outcomes so that we can intervene. It gives us the lay of the land to identify what needs actually need to be targeted, are our resources best allocated to support, and also provide a good starting point of what are the potential modifiable factors to target. So we may not be able to necessarily right now develop a treatment that can treat that child to reduce their symptoms, but what we can treat is develop an intervention that allow caregivers to connect with others, to feel social engagement and collaboration with other families, to have the time to look after oneself. All of these factors combine to ultimately improve the quality of life. So I think when we think about the outcomes of caregivers, that's the key reason why it's important to understand what is actually happening and what needs to be addressed. But then from the research perspective, it's really important to understand what are our interventions actually trying to address specifically, and then better measure the impact of these interventions. As the research grows in this field, we're able to better understand what interventions work for who and how, and then we can ultimately provide better support that's evidence-based, feasible to implement, as well as equitable across Australia and internationally.
You just mentioned then, like interventions in Australia. Is it important, to match interventions to certain like healthcare systems? Because Australian healthcare system is quite different to other jurisdictions.
I think the population being spread out around the coast of Australia means that families who are more rural and remote struggle to access resources in the same way as more metropolitan areas. When it comes to rare diseases, accessing psychosocial support is a big issue. In a study we worked on, Kris, when we looked at the social care-related quality of life for caregivers who had a child with a DEE, some of the key unmet needs they had were around social participation and engaging with others who are experiencing a similar disease as their own child's, have just for oneself to enjoy the things that they enjoy and to engage in hobby, and also feeling supported and encouraged. And I think when people live out in the rural, remote areas, there's less access to these opportunities, less of a community to necessarily understand the rare disease environment and the complexities around it. And so it's really important that when we develop interventions, that we're developing them to be accessible across Australia, but also to address the cultural and linguistically diverse needs of the Australian community.
We haven't talked about this, but in your research, have you seen different needs or outcomes in terms of caregiving between the mother and the father? I know in our work, we did get feedback that people, when they think of caregiving, it largely is sort of higher percentage of females, but that doesn't mean that the males or the fathers are not, being impacted as a caregiver, of course.
Yeah, it is such a challenge when it comes to developing interventions that suit the cohort we're trying to target. We need the research identifying what the needs are and how we need to deliver that intervention. The challenge is with a lot of this psychosocial type research, explaining what you're going through, your experiences, what your unmet needs are. We do typically find that women are overrepresented and mothers are overrepresented in the research. So it is quite difficult to understand from an evidence perspective what the needs are for fathers in the caregiving experience. From the research that has come out, so some of the research that we've done, Kris, we've identified that fathers feel more comfortable to talk to other fathers who are going through a similar experience as opposed to just being part of a caregiving group, which typically involve mothers. They also feel a bit more comfortable doing active coping mechanisms as opposed to passive coping mechanisms like talking about your feelings, connecting with others about what's going on. They prefer doing, whether that may be, running a fundraising campaign. We often see fathers running fundraising campaigns in the child and cancer space. In the setting, when we talk to some fathers, they wanted an actual thing that they could do to take away action and then come back, as opposed to sitting and talking through their feelings. There are definitely different needs. We're really trying to understand what the different needs are and tailor interventions to suit. At this point in time, within the space in Australia, the research is quite limited. We're not able to pinpoint exactly what is needed for which group, whether it be mothers, fathers, or different cultural groups.
So what does the research show actually helps caregivers cope and thrive?
The research in this space is growing, so unfortunately I can't really provide the very strong evidence-based solution or answer to that question. But from my research, interventions that target looking after oneself, social participation, and having time and space for oneself may be particularly effective for caregivers. to have that protected time for a caregiver to engage with their own hobbies, meeting up with friends, and building upon the social networks they already have to allow for this, to minimize any potential feelings of guilt, which we know is a common experience for these caregivers. Having connections to others in a similar situation can be quite helpful, validating their experiences and challenges. And the pilot study that we ran recently, Kris, really highlighted that having that safe space where you could have your feelings, you could have difficulties, and you could relate to one another was really important. And also to be able to give back to other communities and families going through similar experiences that you may have already passed. So really that altruistic benefit from participating in those engagement activities. But one of the studies that we have conducted as well was really interesting, that we found that how a caregiver perceives their child's illness is strongly associated with their quality of life. If they perceive their child's condition as extremely serious, untreatable, nothing can be done, they're really worried about it, they feel as though their child isn't going to thrive, a lot of negative rumination, we've found that those perceptions around the illness, those parents who have higher levels of negative perceptions will have poorer quality of life. Efforts to reframe the situation and potentially engage with more gratitude and mindfulness exercises may potentially be of benefit. But again, like I said, the literature in this space and the evidence in this space is quite minimal. And so we really need to be able to build on these potential hypotheses through what we've heard from families, develop interventions, and then measure them before and after to really know, are these of benefit?
Some of your work that I'm familiar with was a project where you helped navigate families through some information. Do you know if access to reliable information has an impact, sort of just knowing more about the condition? Does that have any influence?
Yeah, I think when we look at the broader literature around rare disease, we know that having access to evidence-based information helps reduce the stress in caregivers. I think there's this big challenge, however, with the space, that potentially having more information can also increase the stress. So having evidence or evidence-based information, there are no treatments right now for your child, can be quite distressing for a parent who may be thinking optimistically. So I think there are different levels of distress. They may feel a sense of distress they don't know. We can resolve that, but then that may cause a sense of distress in now knowing or having an answer around that. So that's quite challenging. I think what we did find is that having access to this service helped put parents at ease, knowing that they're not going to miss out on something. So I think one of the challenges with rare disease space and the pace at which we're moving around novel therapies now, a lot of caregivers have this sense, if I don't Google something tonight, I might miss that chance to enroll in a clinical trial that could cure my child. So they feel this burden to be a good parent, to always know what's happening in the research space, to understand it, to get involved. Having this navigation service available to them put parents at ease, feeling as though it's fine, everything's covered, the researchers have provided me with the evidence, I'm not missing anything. And I think that was really the biggest benefit of that program. Parents weren't staying up all night, not sure what information was relevant to them. They found out what they needed to know, and that gave them some respite in that sense.
That really resonates with me. A bit further down the track, I'm not up every night, but I know, there are definitely families and parents that are, still seeking answers and treatments for their kids. We're going to wrap it up with this last question. In your opinion, what's one thing that every caregiver watching this should know?
Yeah, it's a big question. I think I'll be cheeky and try to get two in for you. I think the first thing I wanted to emphasize is that there are a lot of clinicians and researchers who are dedicating their life's work to supporting families who have a rare disease like SCN2A. Whilst you'll often hear us collectively refer to rare diseases, that doesn't mean that we're not thinking about you as individual conditions, and families, patients, children, and mothers and fathers advocate to government, to policy, to pharmaceutical companies to make sure that the community is aware of rare diseases in general, but we are still targeting each individual condition to address the challenges and the needs there. We need caregivers and families to be involved with our research. We don't know too much about what fathers actually need from us. When we engage in research studies, having more families participate will allow us to better understand the needs, better address them, and provide better evidence-based care for the whole community. So I think that's kind of like a key takeaway for me as a researcher. I would love more families to be involved so that we can provide better services across Australia. Secondly, from the research that we've done, Kris, the biggest takeaway was that caregivers neglect themselves. They don't engage in their hobbies anymore. They don't see their friends. That can have detrimental effects on their quality of life, which can impact their caregiving ability as well as family functioning. It really is important to take time for caregivers, set it aside for themselves. So setting themselves simple goals of take a short walk in the sun today, for example, and build up your tolerance for being away from being just a caregiver. Build up that tolerance to just enjoy yourself and practice mindfulness during that time. So don't think about what medical appointments do we have next week? What do I need to get at the grocery store? Think about the sun, notice the sun on your face or the color of the leaves. These small actions can have a meaningful impact on your quality of life.
Sometimes we have to bring ourselves back and remind ourselves. A lot of us across our lifetimes have carried out mindfulness activities, but they get lost in the chaos of parenting in that rare disease space. So I think that's really great advice. I really want to thank you for your time today and just really appreciate the work that you do and your dedication to families like mine and others with related disorders. I personally find it comforting knowing that people are working to improve the quality of life, either for us or our broader family. So thanks for all you do.
No worries. Thanks so much for having me, Kris.